4, 3, 2, 1. We are live now.
So, greetings everyone, and welcome to OrthoTV for this Voice and Wow webinar, which is tandem webinar on topic of getting stronger together. And I welcome all the faculty here. This is also going to be streamed live on Viro Global platform, and I thank everybody for agreeing for it. Without any delay, I'll hand it over to our moderator convener, Dr. Rujuta ma'am. Over to you, madam.
Thank you, Ashok. Greetings on behalf of WOICE, that is Women Orthopedic Surgeons of India Collective Empowerment. Greetings on behalf of Indian Orthopedic Association, our parent body, and we are so proud to be part of them. This is, I think, one of the most wonderful events of this year, that we have the best of talent from around the world, strong women who've made their mark and are here to share their journey with us today. So without much further ado, let me start my slides, because the speakers are really exciting. Is that full screen visible?
Yes.
Yes, thank you. I'm sorry. So I am Dr. Rujuta Mehta. I will not waste much time on my introduction, but I've had the unique opportunity of starting Voice for India. And more so because I think I'm indebted to where I am today, because I stand on the shoulders of giants, especially this giant, Dr. P.K. Mullah Firoz, to whom I dedicate the entire session to. She was the first lady to take up orthopedics in India more than 66 years back. She was awarded the Knight Order of the British Empire, and she was a war veteran. She headed the Children's Orthopedic Hospital at Haji Ali for almost 30 years. And to commemorate her memory, National Cerebral Palsy Association has celebrated or decided to celebrate a National CP Day on her birthday every year, that is 3rd October 2008. All of us in the journey of orthopedics as a woman have been at these kind of crossroads, and a lot of questions, much more than what you see on the screen here, have been either thrown at us or asked to us by well-meaning colleagues or friends somewhere or the other. And that was the genesis of the idea of this symposium today, to talk about two important topics. One is work-life balance, which is very, very important for a woman. And the other was opportunities. So if you get your opportunities right, and if you can maintain a good work-life balance, I see no reason not to do orthopedics. And all the ladies here have already achieved that. And therefore, they are here to tell you how to do it better. Voice, actually, the thought started in the golden jubilee of the IOCON, that is our annual conference in 2005, when we realized that we were exactly 50 ladies in India doing orthopedics actively. But it did not get, we had a lovely symposium there, but we did not get a formal recognition as a subset. Because I think society traditionally, although India has had many women leaders in many subjects, either looks at a woman as a chronic long-suffering one or a glamorous doll. So it took a bit of combat skills and training yourself in brawn and literally breaking the mold by so many women to get an opportunity to step into the executive of the IOA in 2016 and 17, when I managed to establish it as a formal subset, with the idea of advocating and encouraging women in ortho, bringing about a collective empowerment and bonding, because this is so important when we are a minority and a male-dominated profession, fostering better education, increasing the opportunities and representation of women in ortho, and for mentoring, which was so important, so that what hurdles we face during our journey are not faced by the younger generation. We created a dedicated 1-hour session annually at the IOCON. We've created a best paper prize in Dr. P.K. Mullah Firoz's honor. We've been conducting CMEs through the last few years. We'll give you a glimpse of that shortly, at every level, at UG, PG, and at consultant level. And the need of the hour, a much needed counseling cell for the various difficulties that they go through during their career. And also we do a lot of community awareness drives for issues related to women's health. where do we stand today? Let's take a look at the few glimpses of the webinars that have been there. 2018, a webinar on International Women's Day in 2019. In 2019 in IOCON again, we had the fortune of hosting Dr. Christy Weber, and that was the first Mullah Feroz session. You see all the girls lined up here and vying for a prize paper. From there on to a presidential theme center stage symposium. In 2020-21, thanks to the COVID pandemic, everything became a virtual world. And we took advantage of that and even conducted a training of trainers for the undergraduates and the residents. And literally, this was the most vibrant year where we had a series of webinars in the entire October month in honor of Madam Mullah Feroz. Some glimpses of community awareness drives that we've been doing over the years. We are about 330 women in India and still counting. Most of them are residents and fellows. Some of us are in leadership and teaching positions, including HODs or even presidents of associations or in the presidential line. Almost 15% of us are only into institutional practice and only a very small percentage in private practice yet. But I'm sure this will change over time. And a lot of us now have publications, books, and we are reviewers or editorial board positions to our credit. At best, we are still a work in progress. 330 versus 13,000 orthopedic surgeons in India is still a small percentage. We are connected via social media and we have regular interactions. We do plan to put up everything about voice on the IOA website. These are some of the emerging patterns and distribution of what kind of specializations the ladies in voice are pursuing. And if we look at the geographical distribution, the southern state of Telangana, where you have a special reservation for women in ortho, in medical colleges itself, seems to dominate. Maharashtra, where three of us, or rather all four of the Indian-based speakers hail from, has a good percentage. And this is closely followed by Andhra, Karnataka, Tamil Nadu, Kerala, and the rest of the map as it lights up here. Some of us have even had the opportunity to get international prizes. I'm sure Dawn will be talking about them in detail. And that's the other list of the achievements. But what is yet unexplored is the IOA Inland Fellowships, which I would urge all our ladies to vie for. These are stipendary positions. As you can see, the maximum benefit you can avail of is the Yuva Mentor Fellowships, so that you can excel in the field of your choice with any mentor. And for the consultants, there are many exchange positions which we can apply for. Details are all up there on IOA website, and the last date to apply for them is May every year. So to sign off and start this exciting symposium now, this is going to be our motto, hence, excellence in surgical and soft skills. And a tagline which has been given to us by our IOA President, Dr. Ramesh Sen, we can also shine, to give it a very positive thrust. And with the APOA and the WOW international liaisons that we have, we are definitely stronger together. We have formed a voice council as of now, where we're almost 10 to 11 members of us represent all the activities. 3 of the members from the council every year will be getting a representation in the IOA. The Maharashtra Orthopaedic Association has started Anmol, which means priceless in our regional language. Active network of Maharashtra orthopedic ladies. We are going to focus more on the geographical underrepresented states in future, encourage membership at every level so that you can avail of maximum benefits for the IOA, and try to do our best. I welcome Dr. Ramesh Sen as this juncture, as I see him there. And let us have the proud privilege of one of the most supportive men in the IOA to unveil, to give us his blessings and unveil the voice movie.
Greetings from Indian Orthopaedic Associations to all the participants. I'm really thankful to all of you to have contributed to a very noble aim which Dr. Rujuta has been after. I'm very happy that we have got a strong lady and definitely a big wish. And as she said it, can shine, she will shine, and she should shine also. I mean, this group will be the most emerging group and probably the earliest possible shining group also in the future, and that are my best wishes. And I definitely wish that Indian level of working also goes to an international representation, as has been there in many countries, So I want our work, the ladies which they are able to do it, should expand. I was just looking at the field, pelvic trauma, still your marking was 0. I want many people right now. I was conducting a workshop for ladies, and there was a lady in the group also for pelvic trauma right now also. So I am sure that even that 0 will be changed to some numbers. All my best wishes to all of you to have a successful meeting. Thank you.
Thank you, sir. And please, will you declare the movie open?
Okay, so please, let's have this movie. This is a wonderful movie from Dr. Rujuta about Indian Orthopaedic Association, how it views our ladies section.
Chasanal, please do the honors. And a big round of applause for Namrata, Ekanki, and Kiana, who stayed up all night to do this movie. It's in the regional language, Hindi. The sound needs to be better, Chas.
चली हूँ आजादी की जंग जिंदा मुझे बेखौफ आजाद है रहना मुझे बेखौफ आजाद है जीना मुझे बेखौफ आजाद है रहना मुझे लेकर सूरज से आगरा गाए जा अपना राग राग कुछ ऐसा करके दिखा खुद खुश हो जाए खुदा आशा मुश्किल नहीं कुछ भी आशाएं उम्मीदें हंसी अब मुश्किल नहीं कुछ भी चल पड़ी है हम सफर अजनबी तो है डगर लगता हमको मगर कुछ कर देंगे हम मगर ख्वाब में जो दिखा पर था छिपा बस जाएगा वो नगर बादल पे गाँव है या झूठा गाँव है अब तो भाई चल पड़ी अपनी ये नाव है या झूठा गाँव है अब तो भाई चल पड़ी अपनी ये नाव है
Well, thank you very much. That was really lovely. I think the volume was a bit low, but it starts with the difficulties, then it talks about hope, and then finally it says how all the young girls are ready to go and there's nothing to stop them. The sky is the limit. So over to Mari and Camila, who are our moderators for today. Let's begin the talks.
Thank you very much. Good afternoon, everybody. My name is Marie Thiart. I'm from South Africa. I am the president of the South African Female Orthopaedic Association, and I will serve as moderator for the first session on work-life balance. I'd like to introduce our first speaker, Binoti Sheth, who's going to discuss teaching and academics, a perspective from India. Thank you.
Thank you very much. And is my screen visible?
Yes, it is.
Yeah. So I've been attached with teaching and academics for the last 24 years, having worked at 2 of the major teaching institutes in Mumbai. And if you look at the annual workload that we cater to is almost more than 64,000 orthopedic OPD patients and more than 3,200 major surgeries every year. So this amount of huge workload is managed by the whole department under the leadership of our head of the department. I work as a professor and head one of the units. And in my team, I have 2 assistant professors and some senior residents. These are qualified orthopedic surgeons. And we have certain students of 1st, 2nd, and 3rd year who are the postgraduate residents in working in the department. So attachment to such a teaching institute is purely on basis of merit. There is equal opportunity, equal commitments, and equal pay for males and females. In fact, we get strong support and encouragement from our administration and also our professional bodies. So the work involves mainly the clinical work. So as you can see here, we have challenging cases like this girl who presented a case of congenital pseudoarthrosis of tibia at the age of 19 years. With this deformity, she had never walked. And we had the challenging task of making her up and about. So our teaching actually involves day-to-day work, and during managing these challenging cases, we teach our residents. Of course, we have to take certain lectures, formal lectures, and conduct CMEs for our undergraduate and postgraduate students. We are involved in the research and thesis work of our postgraduate students. And being medical teacher, we also have some exam-related work, like we have to do paper setting, corrections, take practical exams, vivas, and we do have some administrating work, like attending meetings, doing inspections for any new procurement or any OT setups, and etc. The advantage of working at a teaching institute in India is that I have a shared responsibility. So this is my whole team, my current unit. So I am the leader of the team, but I have a strong support staff who looks after the work beyond my duty hours. We do get vacations, and that coincides with the vacation of schools and colleges, so we can have a good family time. We do get special leaves if we have to attend conferences. We get study leaves. I did my foreign fellowships while I was a faculty taking my study leave. We have enough resources in terms of instruments, equipments, and support staff and other clinical branch support. We are allowed private practice beyond certain years of your service, and hence there's potential for growth as an individual, and you can have a good academic growth also. I personally feel that there are many more benefits personally to me. Being a teacher is a respectful and responsible status. I have the power not only to give orthopedic knowledge and skills to students, but I can also give them life lessons, like teaching them values and ethics, which is not given in any books. And you always deal with young residents, so you also remain young and youthful forever and cheerful. Being involved in teaching research allows me to make a lot of publications, presentations at conferences. Being an examiner, not only in your own institute, but you're called as external examiner, and that is a matter of prestige. And being the teacher also, only I could be a part of many of the journal editorial board and a reviewer. But let me tell you, even though I'm doing a hospital job, private practice, academic responsibilities in India, a woman has to do multitasking. We have a family system, like a joint family concept in India. So you have your in-laws, parents who are elderly, and you have the task of looking after them. In India, a lady particularly is considered to be responsible for managing the kitchen work, the studies of children. And we have so many cultural and social events where a lady, even if she's working, is supposed to be a part of. But I feel that we should see these challenges as opportunities. And at times where your orthopedic role is taking a backseat, you can utilize them, as I did in writing up, and I published 3 books when I was at a low key doing my orthopedics and playing the role of a mother during pregnancy and other times. I feel if I have to balance my work and life, one must follow certain principles. You must do proper planning, proper time management. You must realize to give priority to certain role at times. In doing this, you must have your passion. Whatever role you are fulfilling at that moment, whether it's a mother, it's an orthopedic surgeon, you must be passionate about it. You should have positivity towards what you are doing. And while doing all this work-life balance, you must be at peace with yourself, your colleagues, and don't compare yourself with anyone. Don't get overburdened and agitated. If you follow these 5 P's, I think we all women can be powerful. And this I call as 5 P's of powerful syndrome. So then no matter how short you are, you may just hardly reach the height of the mic, but your voice will still be heard. And you will have wow moments when even if you are small, you will be taken care of, you will be attended to because you take the center of the stage and you are recognized for your work. Thank you so much.
Thank you, Binoti. I'd like to invite our second speaker, Chasanal Rathod, if you can discuss private practice, travel hobbies, and the urban lifestyle.
Thank you, Mari. And yeah, so I'll be talking about work-life balance and how to manage private practice, our hobby, and the urban lifestyle. So it's very important that to maintain a balance in life, we have a healthy body, we keep it creative, and of course, we have the name, fame game running through. So what would we suggest that we all have each of these hobbies so that we can maintain this lifestyle? And how, coming to the first part of it, how easy is it to make money? When we very well know that there are different practices which happen in different cultures or countries. And what options I had was a corporate practice, a private practice, an institutional or a government hospital-based practice, or a combination of each of these. And this decision is very important. And it's an important decision because it has to be considered taking into view many points, like how much time can I devote to the practice? What are my family commitments? And apart from that, how much and what am I looking for and what are my goals? When we talk about making money, of course, there is a gender disparity in each of the branches, not only medical branch, but even other branches around. And this was a small study done in India, which also spoke about the gender disparity amongst the physician, not the surgeons, although. And this is a data from one of the biggest, one of a very well-known and big institute in India, which talks about that how being a full-timer or attached to one institute may not give you much of monetary benefits, and how running a partial role or having a combination practice is going to help you make much more money as compared to what just being settled in one place would do. Of course, it comes with the cost of extra OPD work, outpatient department working hours. And in that case, how did I manage it? So I currently work at Mumbai, formerly known as Bombay. This is one of the cities very well known in the western part of India and known for its beautiful landscapes and UNESCO heritage. It is also one of the second most densely populated city in the entire world. While it is known for one of the top most richest person in the world, it is also known for the largest slum or the underprivileged society which dwell with us in this city. So how did I manage to go about this city, which was densely populated with all these shortcomings, and how did I manage to ace the practice? So currently I'm working at around 7 hospitals, of which 3 are corporate hospitals, of which 2 are teaching hospitals. I go to 3 private nursing homes, of which 1 is again a teaching place. And it's a privilege to be part of teaching hospitals to impart knowledge to our juniors. Apart from this, I have a clinic of my own and I am attached to a gate lab. And this was not enough in the city of Mumbai that I decided to travel outside Mumbai to serve people around Mumbai. And once a month, I travel to 3 cities around Mumbai, which are in a range of kilometers between 30 to 300. So how did I ace my private practice in the past 10 years? After completing my master's and doing my fellowship programs at different places in India and abroad, I came back and I took one step at a time. I didn't start all the 7 hospitals in one go. It was important to take one step at a time to understand how much I could handle and how much I could deal with. And I added each hospital and each institute one at a time. It is important to plan a travel in a city which is so densely populated and high traffic. So I managed all my practice in a way that I'm not stuck on this side of the road, but rather I'm the lucky one on the opposite side. While the city travels more southbound in the morning and now northbound in the evenings, I chose my practices and hospitals in the exactly opposite direction, which helped me save nearly 1 to 2 hours of traveling every day. Apart from this, it is important that we get organized by using some calendars in our life. A personal calendar which chalks out all the events or all the major family gatherings or other events which are upcoming, which is a personal thing, while a calendar which is attached to the clinic, gate lab, and my personal secretary, which maintains a record of the operative as well as the clinic records, helps to keep a lot of stress at bay and helps to maintain the organization very easily. And what helped more, apart from getting organized, was having a very good team to work with. I've been lucky to have that in the past 2 consecutive years, there has been a female fellow with me for a year for a structured fellowship program. And she is one of the second female fellow with us this year. Apart from this, there have been junior attending and colleagues who have helped me in my day-to-day practice and procedures where I need additional help. And at the gate lab, I have an assistant, additional biomechanist who helps to maintain the records and keep data of all the patients which we are working with. So all of these together teamwork has helped to keep a very good data and help me to manage my practice very easily. And it is important that if you want to go far in life, it's not important to walk alone, but it's good to have a team of people who work with you and who help you around. Not only this, it is important to have a mentor in life because private practice is just not easy. There are times when there could be hurdles. There are times when I needed help, support, and I'm fortunate to have very good mentors in my life in the past 10 years who have helped me grow in my practice along these years. And with all these things, it was very easy to have a very good professional and a steady professional growth with good attachment in the academics in spite of being in private practice. Many people, they told me that once you leave a institute, it's difficult to remain in the academics. But yes, with all the things which I have mentioned before, it is possible, although it might need some extra effort. And with this, how to maintain a good or how to ace in the practice, one of the other thing is self-branding or self-promotion or advertisement. Each of the country has their own limitations, and considering the Medical Council of India, whatever self-branding or advertisement is allowed, that we can perform through the websites, the TV channels, the YouTube channels, or other social media channels. And that's what I promote, and I also encourage others to do that. And last but not the least, in all of this, when we put all this effort, it is important that as a woman who are not very much focused on their investments, we should be very much thinking about our financial freedom and how to utilize whatever money we have made to multiply for us and use that money whenever we need to take career breaks and also as a support system for retirement. We might not be as active as men as we grow older, and that's what many females have told me. And that's how I think this is one of the most important things which women should look at. And while we are looking at all of this, it is a task and it takes a toll on us. So, but it is important that we prioritize ourselves because we know that 54% of doctors, although they just mention that they have gone through burnout, while there are many others who suffer much more, and there would be doctors who would not recommend a career in medicine to their children or near ones. So that's how a burnout affects us. And maintaining this or doing a private practice or running around places or juggling hospitals is tough. And this should be kept in mind. And with this, I would suggest that we take the second thing in mind, that how to maintain a good health and how to remain fit. So coming to the second part of the talk, that how to remain fit, it is important that we have a very healthy diet, things that make us happy or things that make us alive. And of course, do things which is going to keep us fit and healthy. I recommend that we at least have 2 to 3 days of workout, any sort of exercise, and it should be done no matter what. However busy our schedule is, that time should not be missed. And that is supposed to be our own time, and that should be done. Of course, whatever looks nice and rosy in all these slides before, there have been times where I have gone through not only just highs in life, but there are times when we are low. We need support. We need to introspect. We need to look inside. We need to look for help. And that is the time when we should think of mindfulness and meditation. Not every day, but there should be some days in a month when we would look at these things so that we remain grounded and so that we are connected to ourselves. And this is a very important thing to keep stress at bay and do good work as we go along. And what things keep us alive is soaring to new heights, not only in our career, but also in the hobbies or activities we do. Apart from all these things, I am into much more of adventurous sports. And one of it is trekking. The highest I have trekked is the Everest Base Camp at 17,000 feet, followed by 10,000 feet at Bhutan, and then nearby treks in our own country, which I have done apart from Nepal and Bhutan. What thrills me more is my love for cars. And that didn't end just by driving in the traffic in Mumbai, but I also drive on some of the speedways and the motor circuits in India. And I'm part of the Formula 4 racing team. Of course, the COVID has taken this into, the car is now in garage, but hoping back to get into this seat soon. And yes, day-to-day activities which would keep the happiness hormone on a high rush. And this activities is what they keep us happy. And what makes us wiser is traveling. And in the past 10 years, apart from leisure travel, I have traveled to nearly around 10 to 12 countries for attending various conferences, courses, increasing my knowledge and improving the skills. And that's how I think, of course, it makes us wiser and helps us to know the different practices across the world. We are privileged to be in this position as doctors because we get an additional benefit to help people, to make a difference in their lives. And it is important to leave our mark or footprints as we move along. And in all this time, I had a very special place for kids with cerebral palsy in my heart. And over a few years in my practice, I set up an NGO called Footprints, which works at empowering individuals with cerebral palsy. We try to create awareness about cerebral palsy, which is very commonly known as polio still, in spite of all this education. And over the years, I have conducted various marathons and events to create awareness about this particular thing. And we have helped many individuals, not only as a financial support for surgeries, but also for their splints and orthosis, because these people do not have an insurance coverage. And I have done my part of it to make a difference in the life of these kids. So to conclude, I would say that yes, not only as women, but even men have similar responsibilities and things to do. And what we should focus it as looking at our work, of course, not all the time to compete, but to get the job satisfaction and the happiness we want and grow each day, not to compare ourselves with others, but just look at the day which is gone behind and make the next day much more better. Yes, to put ourselves first in all ways. And it's okay to say a no sometimes. It's not possible to be present everywhere and to do everything all the time. So it's okay if once in a while we say a no and maybe or may not be given explanation for it. And yes, we leave our footprints as we live our life on this earth. And it should be by imparting the knowledge, treating people and helping those as we are privileged to do so. So thank you so much.
Thank you so much, Chasanal. I'd like to invite Anna Stefansdotti to discuss academic leadership and work-life balance.
Thank you very much. First of all, I want to thank the organizers and the organizations for the invitation. It's a great honor, and I hope my talk will be of value for our listeners. Let's see. The title of my talk was Academic Leadership and Work-Life Balance. When I started working with the presentation, I wanted to change it to leadership at an academic hospital and work-life balance. So that is what I will focus on. And first, some words about myself. I'm born and raised in Reykjavik in Iceland, and I realized that I have had a, did my,
Yeah, ma'am, please share again. There was some.
Yes, there's something that happened. Here we have it again. I just told you I was born and raised in Iceland. A great privilege to be raised in a peaceful country, especially now when we are seeing a horrible war in the northern part of Europe. And it was a privilege to have a governmental paid education, being able to choose whichever academic career I wanted. And I chose to be orthopedic surgeon. I was supported by a lot of colleagues. And in 1996, I moved to Sweden to continue my education. And I live in Lund. Lund is in the southern part of Sweden, and we have this Skåne University Hospital. This is a tertiary hospital and a complete orthopedic department with 500 employees. And this is the main building in Lund, and then there's a picture from the university, which is a very important part of Lund. In my career, I've been an orthopedic surgeon since 1998. I've been working clinically with rheumatoid patients and prosthetic joint infections. I've written a thesis about the infected knee arthroplasty, and I have really enjoyed working at the university hospital, being able to combine the clinical work with teaching and scientific work. And I've been working both nationally and internationally with infective prevention. Since 2017, I have also had a leading position, first at the arthroplasty unit, and since September, I had the position of being a head of the whole department. And that has been a great experience. There are a lot of challenges. I think that's all over the world. The challenge is being in lead of a large department, and even though Sweden is a rich country, there is this imbalance between the demands and resources. It's partially related to demographics and new treatments, and the COVID pandemic has accelerated all these challenges. Our main problem is to recruit and retain personnel, and we have more and more competition with the private hospitals that are doing the easy operations. And that leads to a frustration among surgeons, and there is a never-ending work with the challenges with work-life balance. But it's also a lot of rewards. You have the ability to have an impact, to have a possibility to change. You get a lot of contacts and information, and sure, you can be very proud of all the good work that has been done, and it surely is important for your personal development and being a better leader. How does that go with the work-life balance? I actually hadn't thought so much about exactly what is the work-life balance. I looked at some definitions, and I found this from the Canadian government. And at the end, it says that work-life balance supports physical, emotional, family, and community health without grief, stress, or negative impact. And it also says that it is self-defined and self-determined. And I, in a part, want to question this. Another definition that I actually find more related to my personal experience, that the work-life balance is the individual's perceptions of work and non-work activities, and they are compatible and promote growth in accordance with an individual's current life priorities. And I found this new paper. It's actually from India about work-life balance. And I think it shows that it isn't only the individual decisions that affect the work-life balance. You have all the individual factors like gender or age. You have your ability, your physical and psychological ability, what you demand of yourself, how your family is and what support you get. And it is so much affected about the organizational factors, like the working hours, what support system you have in your healthcare, how much you can affect your job and your job satisfaction, how the culture is, how the culture is dealing with, as an example, female orthopedics and productivity. And you also have to look at the society, the culture, how it is the culture, who is taking care of the parental work and the housework, what demands do you have and what support. And then I've been very lucky to be in Sweden when you have very good child care, just to mention an example. And what works for me, it comes with experience, and that you will find it will work out. You don't have to panic. You've been in so often in the position, you have a lot of workload, but you know it will manage. Rely on the facts, take it easy, be authentic, be yourself in all situations. Be kind with the personal relation and be respectful to everybody you're working with. Just make it simple. I find cooking and gardening as very relaxing things to do. And the holy dinner, I want to have the whole family with me eating in the evenings. Also to do other things. Music is very important to me, playing the piano, singing in a choir, and taking care of yourself with both motion and sleep, and to have the opportunity to go to nature and to get a new energy. And then I usually go to Iceland with my whole family, just some picture with the whole family going for a hike and having the children gather afterwards. That's really what is important, to be able to combine with the work at the clinic. Thank you very much.
Thank you very much, Anna. Selina, Poon, if I can invite you, please, to discuss private practice in the US with charitable work.
Thank you. I would like to echo the sentiment that I am so honored to be invited as part of this panel. And my task was to speak about work-life balance as a person from the United States. So just a little introduction about myself. I'm a pediatric orthopedic surgeon here in Los Angeles in the US. I do some spine and I do some deformity as well. So I have a good mix of kind of all over the body kind of practice. I also have 2 children with my husband. As you can tell that they are very well-behaved children there. Just a little bit background for our international audience. For us to become an orthopedic surgeon, a person in the United States would have to go through 4 years of high school / secondary school. They would then add additional 4 years of college. And then we apply to medical school, and that's an additional 4 years. And residency is based on the specialties anywhere from 3 to 7, but for orthopedic surgery specifically, it is 5 years for now. Most of us end up doing a fellowship to subspecialize. So I did my 1 year of subspecializing in pediatric orthopedics, and then we get to practice. The trend right now in the United States is for more of us to do more than 1 year of fellowship, but it's just a changing trend. And here's a map of the United States. And I started my practice in New York, and subsequently moved back home where the rest of my family is in Los Angeles. And those are the 2 most populated and well-known cities in the United States. seem to have been stuck.
So I'll just unshare and you can share.
So I should stop share?
Yeah, I'll do that.
Okay.
You can share again.
Share. Let's try that. No.
Just tap on the slide with your mouse.
Oh, here we go. I work for a hospital system that has multiple hospitals in the United States. And lucky for me, it is a charitable organization where we treat all patients regardless of their ability to pay. So if you can pay, we will bill for your insurance. But if you can't, we'd be more than happy to provide all your care for free. And the culture inside the United States is a very multicultural nation. In fact, we are still a nation of immigrants. I personally am a first generation immigrant, and I will tell you, the opportunities in the United States are, I would say, second to none, just because I think I really benefited from being in the United States. And I truly believe that I will not be where I am if I wasn't here. So, you know, for the United States, we will no longer be a majority of white persons by the year 2025. 14% of the US population right now are foreign born, and immigrants and their US born children, so me and my children, will make up 26% of the population. And by 2065, 36% of the population. So we are continuing to be a nation of immigrants. And maybe not as bad as India, but we have a very low percentage of female orthopedic surgeons at 5.8%. Lucky for us, we are the lowest subspecialty in the United States. So we are working really hard to inspire more women into our field. And for minority orthopedic surgeons, it is also another very stark fact that we have to deal with, is that we only have 10.7% of orthopedic surgeons who are counted as minority, which is really low compared to our population. And just like women, women and minorities, our percentage continue to decrease as we progress along our careers. And so obviously I don't look like most of the orthopedic surgeons that I work with. These are some of my residents. They are getting taller and taller, or I'm getting shorter and shorter. But I also love working with our residents, because I agree, they keep us young. They keep us on our toes about the newest techniques and newer ways to teach them and have them learn. So talking about work-life balance, and I want to shift the thought process away from balance, because every time we talk about balance is somebody trying to balance on some very unstable base, right? So we're always teetering between like work and life and trying to juggle the two. And I think it's important to think about it as an integration. We're all surgeons on this panel. We know sometimes our jobs bleed into our lives. Our patients sometimes have to come first. And so I think it's important for us to realize that being a surgeon is who we are, even though we have other interests and other things that are going on in our lives. So it should be an integration of work and life. And so my children knows this. I've been very lucky that ever since they were young, they grounded with me. They knew mommy had to go to work. They were exposed to the hospital. And I have a very supportive husband or partner who understands that I want to be with them as much as possible. So we would round together, and then we would go do our weekend activities. And then sometimes, you know, the kids are there eating their lunch and, you know, playing with their toys in my office while I'm doing some work. And my PAs are nice enough sometimes to like babysit my children as I'm seeing patients. So I think, you know, just like everybody said, teamwork is important, but it's also important for us to have very supportive partners who understand what we do. And help us take care of the children. And then I like to think that the fact that I'm raising feminists in my household, and that my children will grow up to see very strong women doing things that they love and helping people that needs help. So as you can see from this picture, this is actually very recent in one of our indications or pre and post-op conference. And I think this is very important for us to normalize having children and kind of sometimes family issues come in. And so this is us having a pre and post-op conference. As you can tell, we are talking about surgery. But here's my younger partners having their babies in conference, and that's fine. The babies are very well behaved at that moment, and so we can talk about work and have our kids with us at the same time. Here are 3 orthopedic surgeons at various stages of their career, all pregnant in the operating room. So it's we normalize the fact that we can be pregnant and do surgery at the same time. And even in the United States, we have very amazing women who represent at the national society meetings and give presentations. And I think this is a new trend that we are starting, and we're trying to push that it's okay to bring your children to these things. It's okay to be both a mother and an orthopedic surgeon, and it's okay to be a leader in orthopedic surgery and have a baby. These are some of the initiatives that are grassroots things that I do, where I try to inspire other young people into orthopedic surgery. My kids are part of it, and so they know that these are important things that mommy does. And finally, I love this picture. This was in it was EPO, so it's not all Americans, but here's a bunch of women. So there's a lot of women available as mentors, as friends, as colleagues. Who are in orthopedics, and my goal is to get more of them into orthopedics so we can grow this group. And always lift while I'm climbing for everybody involved. Thank you.
Thank you very much, Selina. So our last speaker for the first session is Camila de Mattos. She's going to discuss international work culture and how you adapt to fit in. Thank you.
Coming up. Yes, so my name is Camila de Mattos. I would like to thank again Dr. Rujuta Mehta, Dr. Sonali Pande from WOICE, and Dr. Ramesh Sen and the IOA for this initiative, and also Dr. Ashok Shyam from OrthoTV, and also my friend, Dr. Don Laporte, that helped us organize this event. So I'm going to talk about a little bit of international work cultures and adapting. But to talk about that, I am mostly going to talk about my life and my work life, which is also my life, if one needs to say. So I started medical school in Brazil 2001, and this was my first cultural change and experience, being able to see how the public sector in the healthcare worked in Brazil, as most of the medical students in Brazil come from middle or upper middle class, and they usually have access just to the private sector. So this was my first change. I had the idea of doing something abroad, and then I started late in medical school to go through the process of the ECFMG to validate my diploma in the US. So late in medical school, I took the step 1. Back then, there were only some blogs, and the community to make me understand the process was scarce, and I got a little bit of help from colleagues that went through the process and through my university. So my first experience was as a sub internship, and with the help of who was going to be later my residency director. This was me in medical school, and I did a sub internship at Hopkins, and this was a very important experience to me. it taught me different concepts that I could not find in Brazil. At this time, the whole American system was new to me, but I did not, then I was a 5-week sub-internship. I didn't have time to learn about that, but I learned a little bit about mentorship. And it was the first time that I saw female orthopedic residents. I already knew that I liked orthopedics and I wanted to do that. But it was the first time that I had that experience. I didn't have a mentor then. Nobody told me that medical students were not supposed to have like long coats, or medical students were not supposed to wear sneakers to the clinic. So this was something that I learned myself. Maybe it would be a little bit easier if I had a mentor. Then I came back to Brazil and finished medical school, and the thought of applying to American orthopedic residency was there, but without even knowing what I was getting into. Just a quick idea because of this sub-internship. Looking back, I failed to go deep in knowing what needs to be done before want to apply for the match in ortho in the US. But I applied anyway. But as always, as I have had in my life, I always had a plan A, a plan B, a plan C at least. And plan A was getting into residency in Brazil at the place that I wanted to get in, which was the National Institute of Orthopedics in Brazil. And after studying hard, I managed to do that. At the same time, because it was a similar topics, I did the step 2 clinical knowledge. When someone wants to do something abroad and besides what they are already doing, like I was doing residency, time is really a problem. So my 1 week first year residency vacation was, of course, spent doing what it needs to be done. So I went to the US to do the step 2 clinical skills and get the ECFMG certificate, because who needs to rest in their first year of residency, right? And so I did that, and then I applied to the match. Like I said, I didn't have the experience that I needed and a mentor to tell me what to do to apply for the match. So I had I got one interview at Hopkins, the place that I did my sub-internship. And I spent the last couple days that I had for vacation, and I went for an interview. I didn't match that, but I continue my residency in Brazil. Brazil, back then when I did residency, the idea of mentorship, of having someone a little bit older to guide you through your residency and start your career, it doesn't have that name. So the culture is changing right now, but I didn't have that. But I already had my ECFMG, and I knew that I wanted to do fellowships abroad. I spoke to a Brazilian person that was an orthopedic surgeon in the US, and he said for me, it was impossible for me to do fellowships in the US. I did not listen to him, and I continued to do what I thought it was important. So at the end of my residency, I learned about Alex Arcader, who is a peds ortho-oncology Brazilian surgeon that lives and works in the US, and he did residency at the same place that I did. So I reached out to him via email, and I sent my CV, and I said that I wanted to try something there, and he was very, very helpful. That way I got into CHOP, my first fellowship in the US. It was a research fellowship. And then there, a whole new world opened for me. I learned I got Dr. Dormans as a mentor, and I got to know a lot of my colleagues that helped me go through processes and apply to fellowships in the US, things that I never learned before. So I got later on into a peds ortho fellowship at Shriners in Portland. where I got the Dr. Ellen Rainey as a mentor, introduced me to Ruth Jackson Orthopaedic Society. It was also very helpful. And through the fellowship match, knowing that after being in the US, I applied for the Ortho Oncology match, and then I got into Washington Hospital Center in Washington, D.C., which also was a great place that I learned a lot. Coming back to Brazil, after the Ortho Oncology Fellowship, I was not happy with the situation. I think the ways that public and the private system, and also with the society, I was not happy there. So I started to look for places that I could work abroad. That takes a lot of time, research, try to reaching out to people. It's something that it can be very tiring emotionally and mentally. And for 2015, at the end of 2015, I had my first contact with Skåne University Hospital when Anna works. We were together at the same department. I had the first contact with them, and it was my first time in Sweden. I did not speak Swedish. I went there, but I liked the way that they work. I went several times, of course, during my vacation time, because there was not time available to do that type of stuff. And I started to learn Swedish, and the whole bureaucracy and validation process to validate my diploma in Sweden. At the end of 2018, thinking that I could speak Swedish, I moved to Sweden. And of course, it's a process of improving your language skills. And also moving to Sweden in 2018, it started also the second process that you need to do to validate your residency and start to work as an orthopedic surgeon. And that was done throughout after 2018, and presently I am done with all that part. I'm a specialist and I work at the Ortho Oncology department. So work-wise, it gets much easier adapting when you have colleagues that are helpful, that went to similar paths as you did, sharing experiences, tips and tricks from their successes and their failures. Another key element are mentors, senior people that believe in you and are willing to help you. Socially, the key to adapting for me in my private line was in the different places is trying to find people that have similar interests that as you do, like for me, biking, and also finding people from your country that also moved. But the main points from my experience and what I can say to all of you that wanted to try something different is from being a medical student or being later on in life, ask questions. Do not be afraid to approach people in meetings or writing to people that you think might help you or you think are interesting. Try to do a little bit of everything. Be humble and work hard. Trying to move to a different country and going through the process of validating your diploma, you're going to acknowledge maybe deficiencies that you have in your training, and then you need to improve. And it's not always easy for yourself to acknowledge that. So you need to be humble and to acknowledge that and work hard. Look for a mentor, make friends. That's very important. And you're going to fail sometimes, and you're going to get a lot of no's, and that's okay. You just need to keep going. And this is the most important thing: help and ask for help always. Like, help the others. And exactly as Selina put down, you need to lift others while you rise. And I would not be able to do that without the support of my husband, that I love and has been with me since medical school. my amazing family in Brazil and my amazing friends that are with me scattered throughout the globe, and via Zoom meetings we meet, and my new friends that I made also in different places in the world. So that's my talk. Thank you.
Thank you very much, Camilla. So we've got a few questions for the panelists in the first session. So I'm going to kick it off with a question for Binoti. The question was, did you find work-life balances difficult during the COVID pandemic? And if so, what were those challenges and how did you deal with them?
Yeah, so during the COVID pandemic, we were working in the institutes, but we were doing only the emergency work. So our commitments towards the institute were a little less because we had stopped all elective work. So our orthopedic work was going on. And in fact, I utilized that time in writing, as I said in my talk, and I published my third book during the pandemic. So because the work was less, I utilized that time and diverted to something else. But at the same time, because we were in the institute, the emergency trauma work was still going on. So we did not have any sort of lacunae of doing orthopedic work. So we were still doing that, but at a low key. So I balanced it doing something else.
Okay, excellent. There was a question in the chat that you've already answered, but for those that couldn't see the chat, there was a question about maternity leave in the academic setting and if there was any prejudice. And it seems that there was no issue taking pregnancy leave for yourself. There was a question about whether there are other females in your department, and you replied that yes, there are now 4 present female residents, and 1 more has joined the faculty since last year. There's a question for Chasanal about how do you deal with feeling overworked? Do you think me time, do you have any me time, and how important is that to you?
Yeah, so I think being in the private practice is an advantage because you can control your own work. When it's getting out of the hand, you can always control where and which place you want to take a break or see less patients in that case and see what is important. So I've always managed to do that. And initially I used to work 5 days a week and have 2 days all for myself for doing the marathons, running and all the activities. And I still continue to do that. And I think it's important that we give time to ourselves no matter what. So.
There was a question for Anna. What is the typical working hours in a week in Sweden?
In Sweden, we have 40 hours a week. But if you are a senior surgeon or if you have some leading position, it usually is more. And having a leading position, it easily goes up to 70 hours a week. There is no limit. You have to make the limit yourself and take your own time. You really have to schedule time off. That's important to manage in the long run.
Yeah, that sounds quite amazing and hectic. There were some questions about promotion in Sweden. So the 2 questions were, is there a policy of publish or perish when it comes to promotion? I.e., do you need to be somebody who does research? And then there was a question about whether women are promoted in a similar time to men, or do you think it's slower in Sweden?
I think it's a question of generation. In my generation, there was still some differences in the time for promotion, but in the next generation, I believe the difference will be neglectable because nowadays the young doctors, the male doctors are taking as much leave, having children and so on. So I think it's soon we don't have that. We don't have this it's rewarded if we publish a lot, but we don't lose our positions. we keep working at the hospital, and but we have to finance the research ourselves.
Selina, there was a question on, do you know what the dropout rate is for women going up the ladder to leadership positions? Do you think there is such a dropout, and do you think it is due to family issues?
I think it's really hard to tell. I think there definitely is a dropout rate as women continue to progress up the ladder. A lot of it is maternal bias, right? So it's not the women doing it to themselves, and it's kind of the men being kind of nice and be like, well, maybe you're on the mommy track, you need more time at home. And so I give the more prestigious or the harder things to the other guys instead of to you because you need to be at home. And so that's actually very hard to quantify. A lot of it is women have decided that they drop out themselves. It's not an intentional thing from the men. It's the women kind of like, well, maybe I don't want to. So it's the small slights and it's the microaggressions that we have as women orthopedic surgeons that kind of pushes us out of the academic ladder. But I think, you know, the way to combat that is to make everything more family friendly. And also the men have started to kind of realize that they want to be at home. They do not want to be the absent father. And they want to see their children grow up and be good humans and have a say in that. So I think slowly but surely, I'm hoping America is changing. We are the only industrialized nation to not have a maternity leave policy, which is very, very embarrassing. But our goal is to make our residents and our colleagues take paternity or parental leave so that women can feel comfortable taking their maternity leave.
I can tell you from South Africa that you're not alone. I think even though we've got a national paternity and maternity leave policies, the culture is sort of not normalized. So there's many men that don't take their paternity leave because it's sort of frowned upon. And that is, you know, sort of a culture that we definitely need to change, but you're not alone there. Camila, there's questions about the traveling. So do you think traveling expanded your opportunities regarding career progression?
Absolutely. I think traveling and getting to know other people and that went through different paths and finding out opportunities that I would never have the knowledge if I didn't travel or did something outside my country, unfortunately. That's why I think those types of initiatives that we're doing right now are so important, so we can show people that they can choose. Of course, you can do everything in your home country, in your home state, in your hometown if you'd like, but there's a whole world out there with the different types of career paths and work environments that you can try to pursue. So, yeah.
And then do you think as a foreign graduate, do you think there were job opportunities in the US after your fellowship? Do you think you had the same chance sort of
no.
or access to that job?
The short answer is no, because as in the US especially, there's a lot of things that are in play. It's not just your academic curriculum and your interview with the clinic that is going to, with your colleagues that are going to work with you, but you have visa issues, you have insurance issues. If you didn't do your residency in the US, you can only be board certified, eligible and certified if you go through an academic path. And I think Carley will probably talk about that later on. So it's not, unfortunately, it's not the same opportunities you can get into a place, but it's I think it's a combination of work hard and also being have good timing. Yes.
And then there was, I think probably the last question in the chat to Camila. Do you see a trend of women gravitating towards pediatric orthopedics in all the countries that you worked in, as this is supposedly a better subspecialty for women?
So I think it varies a little bit from countries, and also some countries do not have the data. So like in Sweden here, I can speak to my department. Anna can probably, if she knows a little bit more. In pediatrics, we don't have, we do have women in other departments, but in our department right now, it's only one specialist and a lot of other men. In Brazil, definitely the subspecialty that is that have most women is peds, following by hand. So I was very surprised to see Rujuta's numbers in hand surgery, because hand surgery, I think in the US and both in Brazil, usually has a lot of women. So pediatrics here in Sweden, I am not sure if I'm biased because of our hospital, it doesn't have a lot of numbers. What do you think, Anna?
There is some more going to pediatrics and hand surgery, but there are no major differences, and we have a lot of women in orthoplasty as well and other fields.
This was something that I was just going to say. I was like the happiest when I came here to Sweden and I saw that Anna was the chief for arthroplasty, because I have seen in Brazil just one woman that did arthroplasty, and it's not just her. It's a lot of there's other Anna, there's Emma, it's a lot of really great women doing arthroplasty. So that was really very inspiring.
Yeah, that's certainly inspiring, because it's the same in South Africa. I think there's a trend now for the younger generation to move into arthroplasty, but our older female generation definitely didn't. We've got the same trend of hands and pediatrics. So if there's no more questions, I think we can close off the first session of work-life balance, and then I can, as moderator, say thank you very much and hand over to Camila, who's going to be second moderator for the second session. Thank you.
Oh, thank you all again. So we continue our very interesting conversation. Now we'll talk about awards, opportunities and award for women. And the first presenter is my friend, Dawn Laporte, that is going to talk about opportunities in the USA and also international opportunities.
Thank you very much. I'm going to share my screen. Hopefully you can see that. Thank you very much, Dr. Mehta, Dr. Sen, Dr. Pande, Dr. Mattos, for including me in this program. It's truly an honor to be part of this incredible program. As you know, unfortunately, orthopedics is the least diverse medical specialty for race and gender. This is a heat map showing the representation of women in orthopedics around the world. And you can see that no country has more than 30% women in orthopedics, and 30% has been determined to be the threshold above which impacts diversity. Increasing diversity in orthopedics improves patient care, decreases healthcare inequities, and makes programs and organizations just better overall. Studies have shown that women are underrepresented in orthopedic awards and less likely to receive a leadership award. Awards are external markers of professional achievement and are important for increasing professional visibility and promotion and career advancement, particularly in academia. There are a number of major orthopedic awards for which a woman has never been selected. And this zero number pertains, for example, to the American Academy of Orthopedic Surgeons Tipton Leadership Award, the Humanitarian Award, and the American Orthopaedic Association Distinguished Contribution to Orthopedics. I think, of course, women should be considered for all orthopedic awards and honors, but there are a number of awards that specifically highlight and recognize achievements of women in orthopedics, and this is important. So the Orthopedic Research Society since 2006 has had a Women's Leadership Forum Award to celebrate accomplishments of women in MSK science and leadership in this field. More recently, the American Orthopaedic Foot and Ankle Society has introduced 2 awards just for women, the Career Impact Award for contributions to the field overall, and the Career Development Award for early and mid-career women foot and ankle surgeons. CCOT has sponsors the Marcella Uribe Zamudio Awards. And as mentioned earlier, a number of WOICE members have been selected for this. And this celebrates a young woman orthopedic surgeon who has published in orthopedics or traumatology. The Indian Orthopaedic Association holds a free paper session annually to celebrate diversity, and there's an award in honor of their pioneer, Dr. Mullah Feroz. And just this year, the Ruth Jackson Orthopedic Society has introduced a new award called the She for She Award, recognizing and celebrating a woman who supports and mentors and promotes other women in orthopedic surgery. So in addition to awards, traveling fellowships can be very important for professional advancement, for educational exchange, and for networking. One of the very prestigious international awards, the ABC Traveling Fellowship, which is co-sponsored by the American, British, Canadian, New Zealand, Australian, and South African orthopedic societies, has had only less than 10% of women fellows over the past few decades. Which is considerably lower than the proportions of women in training and in practice, young women in practice. And there are a number of barriers that may keep people from wanting to do a traveling fellowship, and we can talk more about this. And some of them may impact women more than men. So one point is that traveling fellowships may want to consider some adjustments to the time away to make these more appealing. But there are some fellowships that are more specifically for women. The Ruth Jackson Society has the Alexandra Kirkley Academic Traveling Fellowship to support international travel and academic exchange. The Indian Orthopaedic Association has many outstanding fellowship opportunities for both men and women, but encourage women participation. And there are many international fellowships, and I think you'll hear more about this in the next two talks. In addition to those, research is important, of course, for academic advancement, as well as for improving the field and patient care and patient outcomes. And one of the limiting factors for advancing research is grants and funding. Women should, of course, be considered for all orthopedic grants and opportunities, but there are some opportunities specifically for women. The Orthopedic Research Society has partnered with the Ruth Jackson Society for a Young Female Investigator Grant. And this is open to women from around the world, if you remember. They also support one woman each year to attend the Clinician Scholar Career Development Program, which can help propel your career in research. Ruth Jackson has also partnered with Zimmer Biomet for a clinical basic science research grant with preference given to topics in women's MSK health. And there's a comparable resident research grant each year. The Swedish Women in Orthopedic Society has two different scholarships, one for 20,000 kronor and one for 10,000, that helps support women in orthopedics to travel to meetings, visit other sites, and to support their research. So in addition to supporting women who are already in orthopedics, there should be attention to increasing women in the field as well. And we know that one of the barriers to this is lack of early exposure. And so some opportunities for women to give them that early exposure are really important. Societies can sponsor scholarships so that young women can attend the annual National Orthopedic Meeting, which is a great opportunity for education and networking. Scholarships for away or visiting rotations, specifically for women or underrepresented students. Selina Poon talked a little bit about this, but there are pathway or pipeline programs to increase exposure to young women. The Perry Initiative has a program for high school women as well as for women in medical school with hands-on opportunities to experience orthopedics. And their data shows that 20% of women who participated in a Perry program have matched to orthopedics compared with 1% of general medical students. They have over 200 women who've matched to orthopedics. Nth Dimensions is an outstanding pathway program for women and underrepresented minority students to give that early exposure to orthopedics. And they also incorporate a strategic mentorship. The South African Female Orthopedic Surgery Society hosted a hands-on early exposure program called So You Want to Be a Surgeon. And the Orthopedic Women's Link and Australian Orthopaedic Association hosts an essay contest for young women to help promote gender diversity and increase women in orthopedics. So in summary, women remain underrepresented in orthopedic surgery around the world. Women should certainly be strongly considered for all awards and opportunities, but there are awards, grants, scholarships, and fellowships that are specifically for women, and I would encourage you to take advantage of that. I would also encourage our national societies to increase attention to opportunities to celebrate and highlight the accomplishments of women in orthopedics, as well as to support pipeline or pathway programs so that young women see more about our amazing field. Thank you.
Thank you, Dawn. Now we move over to our next speaker, Dr. Juliette Gentle from Australia, talking about traveling fellowships options for women in ortho.
Fantastic. Thank you very much, Camila, and thank you so much of the event this evening for the opportunity to speak today and to share this forum with so many amazing people. My task today was to talk about travelling fellowship options for women in orthopaedics. And as we've just heard from Dawn, and I found out in my research, therefore I've popped in brackets, there's not really any specific travelling fellowship opportunities specifically for women. What I hope to do today with my talk, though, is to inspire many or some, or even just one of you listening tonight or today or wherever you are, to apply for a travelling fellowship and to replace these brackets with an exclamation mark, because fellowship opportunities, travelling fellowships are available, and it would be fantastic to have women doing more of those. So why do a travelling fellowship? I'm now also having problems advancing my screen. I'll just try and reshare that. There we go. So this slide I've taken from the American Orthopaedic Association for fellowship objectives, which really apply to all fellowships and travelling fellowships. So the objectives stated here are many things that I've spoken a lot about tonight. Develop the fellows' leadership skills, connect fellows with orthopaedic leaders and fellow alumni, prepare fellows for the greater challenges of leading and improving the specialty. And I've just added there, by promoting diversity, to confront critical issues impacting the specialty, and also visible role model, also my addition to the slide here. So my background and qualifications for giving this presentation this evening, in 2019, I travelled as an Australian Orthopaedic Association, NZ Orthopaedic Association, travelling fellow with the ASEAN Orthopaedic Association. Pictured here with my two fellow travelling fellows, Rupesh from New Zealand and Alvin from Australia. So I nearly didn't apply for the fellowship when a mentor of mine suggested that I do. So there was some negative self-talk, which maybe we're all a little bit familiar with. I'm too old. Well, I actually wasn't for this fellowship, although there are specific junior travelling fellowships with an age which is generally under 45. I haven't got time. Well, I'd really recommend making the time. It's well worth it. I don't do research. Well, I don't. It's fantastic if you do research and a great opportunity to travel and present. But if you present on a topic of something that you find interesting, and they won't choose me, well, they did. So, and I'm very glad I was selected as well. So during the travelling fellowship over 2 weeks, we travelled to 4 different countries, and in two of these countries, we met up with the Junior ASEAN Orthopaedic Association Junior Travelling Fellows, and we're all pictured here. And you'll see a familiar figure, Dr. Sonali, who will be speaking shortly after me this evening. So the other travelling fellows were from the Philippines, Indonesia, Myanmar, Singapore, Malaysia, and Thailand. During the visits, we visited hospitals. We each gave presentations, did quite a bit of sightseeing, and also ate some amazing food. So the first country was Brunei. And here I'm again with Dr. Sonali and also Dr. Liza Ishak, who was going to become the first locally trained, the second orthopedic, female orthopedic surgeon in Brunei. So my two presentation topics were on musculoskeletal health and also on diversity in Brunei. So I look back in preparing this talk over my presentation, and I've chosen one slide which I think emphasises the value of female orthopaedic surgeons doing a travelling fellowship. And the slide was titled, "How do we approach change?" And the first dot point was leadership. So to all of you listening today, yes, you are a leader. Role models. We can't be what we can't see. So to be doing travelling fellowships, we are really becoming role models to all younger potential orthopaedic surgeons. Mentors, so you can support and encourage other young women surgeons to become involved, and also support and training. So use the opportunity to engage with the wider orthopaedic community. We then travelled on to Myanmar, where we did do some orthopaedics as well as just eating some amazing food. We visited hospitals there. Met up in Malaysia. There's some familiar faces, Dr. Aslina and Dr. Rui, you may be listening tonight, or people who have worked in Malaysia. And then finished off in Indonesia at the combined ASEAN and Indonesian Orthopaedic Association, and the fellows all together again there, and receiving my fellowship award, and with Dr. Chai, who was the previous president of the ASEAN Orthopaedic Association. So I've just included here, really for more demonstration than an exhaustive list. Some of the travelling fellowships are available, and some Dawn has referred to in her previous talk. In particular, the Ruth Jackson Society website really does have a long list of travelling fellowships which are available around the world. Many of the fellowships also are reciprocal, and I certainly hope one day to host the next group of ASEAN travelling fellows here in Australia. So to summarise, travelling fellowships are available for all orthopaedic surgeons, but it is so important for women to be involved. And there are many, some as short as 1 to 2 weeks. So time doesn't necessarily have to be as big a factor for much longer fellowships. The rewards, nevertheless, are well worth the investment in time, and the benefits will be felt beyond your own experience and certainly beyond your expectations. So thank you, everybody. Thank you to my family pictured here, and to all the organisers and the opportunity for speaking this evening.
Thank you so much, Juliette. Very, very good presentation. We continue then with Carley Vuillermin, relocating and career building, how to plan your fellowship and choose your opportunities.
Thank you very much, Camilla. I have to say that Camilla's talk just resonated very strongly with me as somebody who did relocate and then have to career building was my topic, but really it's actually career rebuilding when you move from one country to another. I'm not quite sure how I ended up here at Boston Children's Hospital and teaching in the Harvard Medical System when I started in this rural town in Australia. And I would like to say, like, Camila seems to have been a lot more thoughtful and a lot more deliberate in how she went about doing what she did. I didn't plan to move to the US to continue work. I wish I could tell you that it was easy, but I think Camila's given you some insights that it isn't particularly easy. And I wish I could say I'd do it again if I knew what I knew now. I probably wouldn't, but I actually wouldn't change what I do now either. So I'm not leaving. But it's a lot of work and there are a lot of obstacles that you have to overcome, and you do have to be humble. And sometimes you have to be humble about your skills that other people no longer see as valid skills because they weren't obtained in the jurisdiction that you now work. And so I think becoming recertified as an orthopedic surgeon in a new jurisdiction once you've moved from one country to another is very challenging. I'm going to call these my early years. They happen to be like the first 15 years after high school, where I was in Australia and I did all of my training in Australia. And it was during this time that I developed a weird subspecialty interest in pediatric upper extremity surgeon, which in Australia at the time, there really wasn't an orthopedic specialty or a fellowship that I could do to do that. And so therefore, I truly, as Camila spoke about, that mentors are absolutely instrumental. The first two gentlemen are Professor Graham and Mr. Thiart, who were from Melbourne, and they reached out to their friends and colleagues who were Dr. Kasser and Dr. Ozaki from Boston Children's Hospital and Texas Scottish Rite. So really, you can be lucky or you can have good friends. And I think that good friends are very important, in particular senior mentors, if you're looking at changing, if you are looking for international opportunities. I went about very deliberately developing the skills that I needed to have the specialty that I wanted to have, which was to do pediatric upper extremity limb reconstruction, which isn't really a defined specialty at all. And then I did end up being recommended to come to the US for fellowships because there really wasn't an equivalent specialty in Australia, but people like Peter Waters at Boston Children's Hospital and Mary Beth Ozaki at Texas Scottish Rite had established that as a specialty. So in order to do my pediatric orthopedic and pediatric upper extremity fellowships, I had to suddenly at PGY 10 sit my USMLE step 1, 2, and then get my ECFMG certificate. You really can't work in the US without your ECFMG certificate. And if you want to do fellowships, there are several ways to do a fellowship. And I think Camila outlined one of the things is that outside of the US, you don't realize how many rules and how the biases within the match process work to enable you to actually be successful in the match. I actually did go through the San Francisco match and I was successful. I thought I had not been because I didn't get the call on the day that I was meant to. It turns out that the people who had selected me didn't know how to call me in Australia to tell me that they'd selected me. So I just had to wait for the email a few days later. International clinical fellowships are around. They're not as widely advertised. They'll still require you to become ECFMG certified, but they are often outside of the match and they do look for a more diverse group of trainees. International observerships, you need to know the vernacular. This means you're not going to touch a patient, but you can be seen in the clinic office, okay? And so if what you're wanting to do is get exposure and learning, but not necessarily hands-on, then an observership might be the way you go. And then international research fellowships, so that was Camila's first one. They're actually non-clinical. You might get a little bit of fortuitous clinical exposure, but you're actually mainly doing research and publishing papers in that time. It may be a stepping stone for some people, though. I personally was not very research focused, and so that was not for me. I had always planned on returning to Australia. Some administrative changes happened at our children's hospital whilst I was away. I was very determined to pursue my chosen clinical specialty, and so therefore opportunities came up in the US that were not available to me. But I will echo what Camila said, is that getting a job is much harder. And there's many things about getting a job which is hard. I now have a department that has resources that are, I don't even think I had the space in my brain to understand the resources that I have now in my clinical work. We have 3 upper extremity surgeons at Children's Hospital. Don Bay and Andy Bauer are my partners. between the three of us, we have a physician assistant, we have a nurse practitioner, we have 2 nurses, we have 3 research associates, we have a research specialist, we have an academic assistant, we also have like a research manager, and we also have like an entire clinical effective research center in our department. And so therefore the opportunities in academic medicine in the US were ultimately what led me to stay. I've actually done an MPH in the meantime, and even just doing an MPH as a foreign graduate was hard because I didn't have my medical school exam for the US, so I had to sit the GRE when I was also being an attending surgeon. So transitions, and Camila said about this, it's not just about getting your piece of paper recognized. It's regulatory, it's professional, it's cultural, and it really is cultural. The longer I was in the US, the more I've realized how different I am to many of the people that I'm around. And I live in the Northeast, which is not, the US is not ubiquitous culturally either. And you have to remain legally in the country that you've relocated to. And that is actually maybe the hardest thing of all. I am still legal, don't worry about that. You think, when people think about the regulatory transition, they think I've got to get registered, I've got to get hospital credentialed, and I need to get insurance reimbursement sorted out at the end. No, none of it happens until you can get insurance reimbursement in the US. So it's actually the opposite way around, even although in your mind you think that once the Blue Cross Blue Shield, which is our biggest payer outside of our government insurer in Massachusetts, accepted me, then every other insurance company accepted me, and then I was fine. I did have to work for 3 years seeing patients with the government insurance without getting paid, but that was just another price that I paid to change jurisdictions. The professional transition is really hard. You lose all of that social capital that you have built up over the 10 years that I worked in Australia. I worked with Juliette when I was in Australia as a junior trainee. She was a younger consultant at that time, or attending surgeon. So I actually got congratulated as a PGY15 for graduating last year because it was the first year I had had a general medical license. So even to be recognized now as a doctor, despite the fact that I thought I was an orthopedic surgeon, I had to become recognized as a specialist again. And I was 7 years in, and the American Board of Orthopaedic Surgery changed their rules that you had to be an associate professor. And at Harvard, people may or may not know, we have a whole extra level of academic rank. And so most associate professors are 10 to 15 years into practice, whereas at many other institutions, they may only be 5. And so I actually initially couldn't sit my ABOS and ended up, I am doing it now. The social transition was actually the surprising part to me because we sound and we kind of speak the same language, but Peter Waters was the head of upper extremity when I joined. And it actually took me 2 years, and after I had signed a contract, for me to realize when he said upper extremity surgeon and when I said upper extremity surgeon, the two of us were not actually meaning the same thing. And that's pretty fundamental because I was employed as an upper extremity surgeon at Boston Children's. You have to also reestablish credit. You know, you're a fully functioning adult, and now you get a $500 credit card that you pay a $500 deposit for. And that not everyone actually understands that your diversity is valuable. So finally, I'll come to immigration. You've got to be able to be allowed to work. Eventually, you're probably going to want to stay and not be at the whim of the government to cancel your visa every 2 years. And then you need to have had a visa that allows you to citizenship. It's the hardest part, but it's the most complex, and it's very country specific. So I won't go into that further. So just as a little snapshot, I actually graduated medical school in 2001, so the same year that Camila did, and I am still not board certified in the United States of America. I work under an academic medical license. I have 2 years ago done the written first part. I've done my case collection, and now I'll have my case defense this year. But I've been here for 10 years. And I'm still not able to spend my whole time doing the fun, interesting research that I like doing because I'm spending a lot of time surviving. And so you just have to know that that's what you're going to do. However, I do get to do really cool things. I get to bring together all of my different fellowships. And so I wouldn't change anything. This is the most important slide. Many people will offer you advice. All advice is well-intentioned. not all advice is accurate. You do not need 3 fellowships to work in the United States. I only had 1.5 years. Those who have gone through the process are best situated to give you advice and to help you solve the crinkles and interpret the English language. And I mean the English language between the US and Australia even. So if you come from a more divergent cultural background than that, it's even harder. So you want to reach out to people. Mentors are essential, but they're not necessarily experienced, and they can feel really helpless helping you negotiate this process. And it is a journey. And no, you're not going to always win. And yes, you are going to come up against barriers, but it can be exceptionally rewarding. I will tell you that on the far right here is Martha Murray, who is now our chief at Boston Children's Hospital. She was the first full clinical professor of orthopedics at Harvard Medical School, and she now leads our department. So although administrative changes at home meant that I didn't return, administrative changes here at Boston Children's Hospital, I think are really looking to the future. Feel free to reach out to me if I can help anyone.
Wow, Carley, your journey is very amazing. Thank you for sharing that. But we continue to our last speaker that also has an amazing story and journey. Shifting gears across ages and continents with Dr. Sonali Pande. Welcome.
Can everyone see my slides?
Yes, Sonali.
I'm extremely proud that Rujuta and me, under the banner of WOICE, the blessings of IOA, could collaborate with Camila and Dawn and WOW and put up this interesting webinar. Following this wonderful lineup, especially the similar topics that Camila and Carley, we have shared about our journey of relocation, I'm proud to share with you my own personal journey, which has been essentially country hopping for education, pursuing finding a balance with work and life. So here's my tale, being a global nomad. I've highlighted my journey, put up some advantages, disadvantages, tried to make it sound less complicated, but I really echo what Carley has said. It is not that easy. Registration, immigration at every stage is a big challenge. But I'm trying to sound little bit simpler, because a lot of trainees are probably watching this seminar and webinar, and I want to make it look doable, and it is. So here's my story. At age of 25, I completed my first master's in India in 1996. After the graduation in India, I moved to UK to do some further training, because I was very keen to pursue super specialized training. I've initially started my work as SHO, and there was adequate funding for me to attend number of workshops and meetings. This helped me in building CV quite effectively. I was one of the first ones to get the Marcella Europe Sicot Award from India in 2002. And it's nice to see so many of our WOICE members have followed the same award and got inspired. In fact, that was the first time I got recognized and felt special about being the lady orthopedic surgeon. Looking back, my registrar rotation in Liverpool region was one of the toughest part of my career. Not only that, I was the first female orthopedic trainee in Liverpool ever, and I was also pregnant at that time. There were no rules and regulation for radiation protection. And I'm happy to note that currently the junior next generation have adequate supports and network and voices to speak out the sensitive topics and sensitive situations I've gone through. Wish I had all that support that time. I finished my UK stay with masters from Dundee University. That was something that really helped me enjoy the international student life while going through the structured program. After UK stay, I came back to India and practiced in my super specialty of interest, which was pediatric orthopedics. And I then followed after 5 years to Southeast Asia, wonderful country, Brunei. Here I've worked for last 16 years as head of the department in the only private facility. Along with research and academic, I could do a number of leadership and administrative roles and enjoy the teaching experiences. End of about 10 years, I would say 5 years back, I felt that I'm overstepping on my shelf life there. I didn't feel the challenges and kind of stagnation, found there were lack of opportunities for me to show my mettle. Along with my colleagues from Brunei, Lisa and Lydia, we form a statistically significant group of women. However, we are still struggling to form our official network and hope one day this dream comes true. Brunei offered me unique exposure to boutique hospitality. Working with royals was a regular thing till a month back for me. Brunei being part of ASEAN, it was a good exposure for me to form network with the regional societies. We could host number of fellows on a regular basis. Here's Juliette during her fellowship training. I'm still active in a number of Asia Pacific societies. Also, I got opportunity to work and be part of the community, being part of some professional networks. I enjoyed during my stay in Brunei, doing some voluntary work, and extremely proud of the humanitarian work that I could do. I could stay in touch with my parent country, my colleagues. This is me and Rujuta. We dreamt of having a society, and WOICE was the dream come true. It allowed me to travel internationally for most of the conferences. I met wonderful ladies. And most importantly, despite my full-time work, I was able to do distance learning. I completed my certificate and master's in sports medicine from prestigious UQ. And this was a very interesting part of my career. I've actually, apart from 4, I have actually 5th flag under my belt. I got some studies done in rheumatology as well, because there was gap in availability of rheumatologists in the private sector. So going back to academia, I found it was always challenging. You really need to have mindset. You need to have enthusiasm. My mantra is education never ends. Never stop learning, because life never stops teaching you. I traveled extensively in Southeast Asia. And when I was trying to do this reset, readjust mode, I got a chance of a change, a new opportunity. And here I am last 1 month in Darwin, and I'm doing my fellowship here. My experience and training and research got matched as specialist by Australasian College, allowing me to practice in Australia and New Zealand. I'm 4th such overseas trained specialist, and I'm also working full-time as a sports medicine specialist in Darwin. My accountant should be happy that I also got the rural training program, because that keeps my paycheck decent. And I hope to take this further and do some more research in this field. I want to highlight the common myths we harbor. Change is risky. Well, I don't think so. Changing your career means that you have failed in the first career. I have always left on high. I've made sure that I'm not burning my bridges. It's very important that you don't get blinded by what you love. And as you progress in your career, your self-worth and self-esteem definitely take precedence. Your passion should not stop you from missing the wider opportunities. And as rightly we have discussed earlier, travel does give you more options. It can take longer time if you don't do time management and financial planning. It's very important to know that it's never a leap of faith. It's a deliberate small changes that you have to make, and you definitely have to create momentum in your career profile. It's a myth that it can be exhausting and it can be expensive, and definitely it's never too late, and definitely you are never too old. Here I am in my golden year, having spent 25 years, half of my lifetime away from my homeland. And I truly believe if I don't do it now, then when? There can be a number of reasons doctors seek advice for potential change in their profile, especially change in career and migration. There are more acceptability by everyone, and it has become mainstream for us to seek for any changes. There are a number of helps that one can take, and it's very important that we use our existing skill. Many women leaders are already using this and donning different caps, like moving on to academia or moving more on public health or health advocacy roles. Specifically for orthopedics, sports medicine, regenerative medicine are very lucrative migration options. Where do we start and where to start? I think we need to have all of these to make a soft transition. It's very important that we have kind of a SWOT analysis of self and try to have a checklist, and need to make sure why we are doing it, how we are planning to do it, how do we prepare it, and how we break through. These are topics in itself, so I'm not going to go in detail. Personally, for me, I belong to a family of orthos. Here's my mentor, my father. You have seen the fellowships in his name. But my main pillar of strength is my partner, Ketan. We are growing together for last 28 years and raising two wonderful kids. Nothing of this can be possible without financial independence and financial intelligence. I think Chasanal has already highlighted this. This again is a very important aspect every lady must be acing. There are a number of challenges. We've heard from Carley about the immigration registration rules. They can be very unique. However, it's very important to know that the challenges for ladies in work field are same in most countries. They don't change. We are lucky to have more support networks nowadays, and there is global awareness of gender bias and how we overcome all that. I've also gone through my what if moments. What if I had stayed back? I had a family privilege. My family ran a 75-bedded orthopedic center. It was so easy for me to stay back. It would have been a good one for me to consider sticking to single super specialty. But here I am, being a wanderlust and respecting, learning new cultures, balancing my family life, reclaiming my middle-aged me. I'm definitely finding my inner space. I'm deliberately slowing and creating more options for me for my retirement. I'm not one in a million girl, but I'm also one in a lifetime lady. I'm quite eager to see what's unfolding for me next. If you seek growth, be ready for the discomfort of becoming bigger than the box they put you in. Finally, right or wrong, it has all been my decisions. I've been following my bucket list. I've been ticking my own boxes. Age and geographic locations have not stopped and limited my flight. This is again a myth. You don't really need to be strong. You need to be fearless. So to all of us, this is an ode defined by no man. You are your own story, blazing through the world, turning history into her story. And when they dare to tell you about all the things you cannot be, you smile and tell them, I'm both war and woman, and you can't stop me. So all wonderful ladies, I wish you a happy International Women's Day. Let's break the bias. And thanks for your patience.
Thank you for the wonderful talk, Sonali. It was very interesting, and also as Carley talked, they talked very close to my heart and my experience. I think one of the things of doing what I did, and Carley and you, even though Carley said she didn't had a initial plan to stay, She did. And the thing is, it's very interesting to know that this is not a path, at least for me, and maybe I can maybe speak for you as well. When you choose to do something like that, to take a leap, to move to another country, is something that is not, you don't know if it's going to work. You go and take a leap of faith. And you trust your guts, and you also, this what if question, for me at least, the what if question is, what if I don't try? If I don't try, I'm going to regret it. So I think it's worth trying. And also talking about how expensive this is not just in terms of money. All the USMLE tests I did with money that I gather myself. People were like buying cars and stuff. I was paying for the USMLE and air tickets and stuff like that. It's also like how determined you are and how much you want to invest your life in your, it's not just your career, but also life experiences and changes. So that's very interesting. I'm going to go through here through the questions. Dawn did an excellent compilation, and we had a question here in the chat, but we can repeat to the audience. In your opinion, Dawn, what do you think is the reason that women get less awards or scholarship? Is it hesitancy, or toll it might take on personal life?
Thank you. So I think 2 parts. One, for traveling fellowships, I do think women sometimes are concerned about the toll on personal life and time away from family and children, and that impacts men as well. But I think it blocks women from applying more frequently. And I think, the concept of having 1 or 2 week stints away is much nicer than having a 3-month block all at once. So that may be a consideration. For awards, though, I think it's multifactorial. I think women don't necessarily put themselves up for awards as often or as early as maybe men do. I think they don't appreciate how outstanding they are and what their accomplishments are. And I would, encourage you all to put yourself out there and to bring people up along the way to nominate your women colleagues for these awards, because I think they're not going to self-nominate.
I think the award things, I didn't know how it worked, like if you need to actually put yourself out there. But I think women in general, especially like applying to positions, to like higher positions, we feel that, I think most of us feel that we need to like check all the boxes that are listed for the requirements for the jobs. And sometimes like the lack of confidence, maybe I'm not up to this, or what, like, am I really worth of an award? So I think that probably it gets in the way of us doing things like that. Also, there's a little bit of culture things as well. I don't know. Selina, do you want to say something? I see you.
Yeah, I agree with you, Camila. There's actually research on this. I'm kind of a research nerd. So men tend to apply for positions when they check 60% of the boxes, versus women have to check 100% before we apply. This is very well shown in like the business environment, and I will 100% tell you this is probably the same for us here in the medical environment as well.
Yes. Okay, we have a question for Carley. Can you tell us about whether some ladies have had to change the specialization totally because of the complexity of the process to establish yourself in the US?
So I established myself so that I could continue with my subspecialization, but certainly it depends what your priority is. So mine was to have a job within my subspecialization, but some other people are to avail themselves or their children or their families of the ability to remain in the US. And so I think there are definitely some people who have changed jobs for that. I have also now known some people who are leaving the bigger academic institutions and going to other academic institutions that the academic rigor to get to associate professor is not as high. so that they can sit the ABOS exams, because the current ABOS system in the US favors academic progression rather than harder skills. So there are definitely people who have changed institutions and left the Harvard medical system to achieve the academic rank, because for them being board specialized is important. I've also had people who have come to the US to become orthopedic surgeons. One of our research manager is an MD from Ecuador who trained in Argentina. And she actually, after many years of trying to transition, has now decided to pursue a career in research management rather than becoming an orthopedic surgeon again, despite the fact that she was an orthopedic surgeon in Argentina before she moved to the US.
Wow. Question for Juliette. How has the scene changed from the last 5 years according to in terms of traveling opportunity vis-a-vis in the Pacific region in your experience?
Thank you for the question. The past 5 years, I don't really know. I can certainly comment on the past 2 years without going into too much detail. I think with all travelling fellowships being on hold, however, there's a lot that's been going on which will be helpful into the future for women doing travelling fellowships in the Asia Pacific region. I think probably most importantly would be the Asia Pacific Orthopaedic Association has developed a women's support branch. And look, hopefully that will drive, well, we've talked about mentorship and leadership and visibility and support. So hopefully there will be more female orthopaedic surgeons involved in the Asia Pacific Orthopaedic Association who can feel confident and interested in stepping up for those travelling fellowship positions moving forward from here. And just having conversations like this is just important for going forward, improving those statistics.
Question for Sonali. What role does age play in terms of preserving the drive in your mind, especially when it comes to uprooting yourself and reestablishing yourself all over again?
Camila, as you've heard in my talk, I think it's just a mindset. Age is just a number. And I think if you have had your mentors who have been working for long times, and you've seen that it's quite easy for you to transit from your role. You can choose your own boundaries. You can try and go for restricted hours, and you can change your priorities as you are progressing in your career. So I think for me, I see this as no limitation for you to continue trying for newer positions, newer opportunities. At age of 50, I'm setting up my house again. And it is exciting, I think this keeps it more adventurous, and I think I'm enjoying it, and whether I'll do it again, I don't know. But I think age is definitely not a limitation. I've got a wonderful opportunity to come to a family which is pandemic separated for last 2 years, and now study here in Australia, and also give more opportunities for my children. So yeah, I think age is no limit.
Thank you. I see Rujuta has do you have a question, or can we wrap up, Rujuta?
No, I just had a additional comment to make in connection with what question was raised to Juliette, that I think in Asia Pacific region, now that WAVES has been officially set up, we hope to expand these opportunities for sure, and work is definitely on, and we are working towards that, and probably the scene should improve quite well in the next 2 years. And yeah, I think it is pretty much, it's 7:10 already here in India time. So I assume it must be very, very late for Sonali and Juliette there. It's been incredible. All the speakers have really done a fabulous job. I know we've really overshot time a little bit, but that's okay. I think it was important. All the information that was exchanged is very valuable. What is heartening to me is that two things stand out in what all the speakers spoke, that there is always going to be a change. It's important to embrace that change. It is important to have a lot of self-belief. And the other thing I think I really found is that, no two people have had the same journey, but everybody has had their own share of challenges and their own share of satisfaction. So it's good to hold hands, and it's really nice to see that this generation of all of us, it's in fact the perfect time that everyone has come together and create more opportunities for the next. So I don't think any of our PGs or residents who are tuned in should have any fear. They should realize that it is very good. In fact, it's a very opportune time that everything is bonding together, blending together. One of the blessings of the pandemic that we've all come together to create and co-create something which is so important for the generations to come. So if there are no more other questions or any comments from any of the speakers, should I go ahead and do my customary thank you?
Of course. I would like to thank you all. Also, thank you for letting me moderate this amazing session. Thank you for all the speakers. It was amazing.
So I'll begin with a big thank you to my partner in crime, Sonali, who's always been dreaming along with me right from the voice inception to this stage and bringing voice to an international platform in the past 6 years, which is great progress for a small group in the IOA. I think Juliette has something to say before. No, she's given us an
clapping.
applause sign. Okay, great.
Round of applause.
Yeah, round of applause. And then my second thanks goes out to the absolutely amazing Camila and Dawn for so readily agreeing, for sparing so much time, for going through all the details and planning this symposium again and again. My heartfelt thanks to each and every speaker here, Anna, Binoti, Chasanal, Carley, Juliette, anybody that I'm missing, Dawn, of course, again, and Camila all over again. My heartfelt thanks to Ashok, Shyam, and Selina, of course. Fantastic talk, Selina. My heartfelt thanks to Ashok, Shyam, and OrthoTV team. My thanks to the IOA for really allowing us to be celebrated. I think in India, women are known as Shakti or energy, and energy is really worshipped. So the winds of change that have happened over the last 6 years have been absolutely incredibly amazing. A big thanks to all my young and enthusiastic residents and students, Kiana, Namrata, and Ekanki, for putting the video all together. I think we'll work on it a little professionally and get the audio improved and subtitles also put so that we can share it with everyone. And last but not the least, thanks to the entire team today and both my moderators, Camila and Mari, for really bringing out every aspect and sparing so much time for this wonderful symposium. And if I've missed anyone, big apology, but this has been incredible and all the talks have been very informative. I think Ashok has something to say to us in terms of how much this will be available and how whoever else wants to tune in can access this as a part of the VIROC Global. So over to you, Ashok, before we wind up.
Thank you, ma'am. And it was really an amazing program. I enjoyed thoroughly the experiences, the insights, and I mean, it was really amazing. I was speechless after the program. About the availability on VIROC Global platform, we have more than 70 orthopedic associations from around the world that are participating now. And members of all those 70 societies will have access to this program. And we are looking at a number of around 80,000 to 100,000 orthopedic surgeons visiting the platform over a period of 3 months. And they will all have access to this program and they can all watch. They can even ask questions which we will provide to you to answer in your time. So that's around the outreach that we are looking at for VIROC Global. So thanks again, everyone.
Well, thank you. Can we stop the live
Thank
session
you.
now?
Yes.